Ischemic heart disease is a broad term, including several closely related syndromes caused by myocardial ischemia and inadequate oxygen supply. This usually happens due to an imbalance between the cardiac blood supply in one hand and the myocardial oxygen and nutritional demands on the other hand. Why it's important? Because ischemic heart disease is the leading cause of mortality in the United States and other developed nations, accounting for 7 million deaths worldwide each year. Ischemic heart disease happens usually when the myocardial perfusion or blood supply cannot meet the demands. This can happen due to one or several pathologies affecting the myocardial perfusion and/or the demand. The first, when the coronary lumen is narrowed by atherosclerotic plaque, which we call usually the coronary artery disease. This will result in decreased myocardial perfusion, so the oxygen and nutritional supply cannot meet the demands. This accounts for more than 90% of ischemic heart disease cases. Another mechanism, when the demands are increased, as in patients with increased heart rate or hypertension. In some cases, the blood supply is okay, and the demand is not increased. But the blood volume is decreased, as in patients with hypotension or shock. Another mechanism, when the blood supply is okay, the demand is not increased, and the blood volume is normal, however the oxygenation is decreased. This may happen in patients with pneumonia or congestive heart failure. Another scenario, when the oxygen carrying capacity is decreased, and this may happen due to anemia or carbon monoxide poisoning. Ischemic heart disease can present as angina, acute myocardial infarction, chronic ischemic heart disease with congestive heart failure, sudden cardiac death. The first clinical syndrome of ischemic heart disease is angina pectoris. Angina means literally chest pain. So here there is an ischemic event, and the ischemia is sufficient to induce pain. However, it's not sufficient to cause myocyte death, so there is no myocyte death. Angina pectoris can be classified into stable angina. This type of angina happens after certain level of exertion and does not happen at rest. Prinzmetal angina. This type is caused by vasospasm. Unstable angina. In this type, the chest pain starts to happen with less exertion or even at rest. The second clinical syndrome of ischemic heart disease is acute myocardial infarction. And here the severity or the duration, or both, the severity and the duration of ischemia is sufficient to cause myocyte death. So there is a real myocyte death. The third clinical syndrome of ischemic heart disease is the chronic ischemic heart disease with congestive heart failure. This usually happens due to progressive cardiac decompensation after an acute myocardial infarction or secondary to multiple small ischemic insults that will eventually participate in mechanical pump failure. Then the fourth clinical syndrome of ischemic heart disease, which is the sudden cardiac death. It may happen as a consequence of tissue damage from myocardial infarction, but most commonly results from the lethal arrhythmia without myocyte necrosis. Then we come to the term acute coronary syndrome. Acute coronary syndrome, this term is applied to any of those three catastrophic manifestations of ischemic heart disease. The first is the unstable angina, the second is acute myocardial infarction, and the third is the sudden cardiac death. So only unstable angina, acute myocardial infarction, and sudden cardiac death are called acute coronary syndrome.